Good afternoon once again. Today is Sunday, the 3rd of January, 2021, and this is the English language summary of the daily press briefing here at the CCSA. Of course, for those who noticed the first few seconds of our briefing, both in the Thai and the English language briefing, you would notice that we always wear masks wherever we are here in the studio here at the CCSA in the Government House. And we only take it off when we start to speak, we start to air, because of course I'm at the podium here and it's many meters away from our TV crew right now. Of course, the Thai language version of the daily press briefing has a lot of details. The details in the infographic there are completed just moments before the broadcast, so it would be impossible for us to have an English language infographic on all the charts that were shown. The summary that I have for you every day is a recap, and it can be viewed in complement with the Thai version if you have someone to translate. If not, of course, we have English language information going out on social media, as we have informed you quite often, as well as English language news outlets and the press. So please make use of this recap information to complement the information that you have. And of course, we have limited airtime as well. But nevertheless, we try to provide you with the important information, especially for the English language audience viewing here in Thailand and around the world on social media. Just to recap some points of the spokesperson, Dr. Tweesin. The month ahead, 1 month ahead, is very crucial for us now, because since the new wave in Thailand, it's been only around 2 weeks plus. So the 1 month ahead of us right now will be very, very crucial in determining where we would be in terms of the COVID battle. Since the beginning of the year, we've been fighting COVID. Of course, there's this word called fatigue. Dr. Tweesin mentioned fatigue. We hope that if we are determined, we stand together, we will we'll put up our guard quite longer and quite stronger. That might be necessary for us to come up with the energy to fight off this COVID fatigue. Nevertheless, we'll continue on. Around the ASEAN region, the statistics show that some countries like Myanmar and Malaysia have the higher numbers in terms of the ASEAN region. Currently, for Thailand, we have been placed in a higher ranking, which is not good. A higher ranking now for us is 136 compared to other countries around the world. Previously, we were in the 150, 140 ranking. One update is that, of course, you recall that yesterday we talked about the level of more stringent measures, level 1 and level 2, that might be put in place. Of course, all of this pending the order from the Office of the Prime Minister as the director of the CCSA. To date, we are still awaiting for that order. A lot of consideration with the various line agencies are being done currently. This morning, we also had the CCSA meeting in the morning. So we're still waiting for that finalization. In that order, possibly we're having more stringent measures, including that restaurants in the future will be able to only have delivery and takeaway and not in-house. But this is not in place yet. We're still waiting for that. Please continue to follow the updates from the CCSA. It might be today or tomorrow. Also continue to follow the updates and information from the local provincial authorities in the province or area that you are. There might be specific measures for that. Currently, of course, inter-provincial travel is still not prohibited. In the inter-provincial travel, there would possibly be a lot of checkpoints along the way, however. And in some provinces, if you travel to certain provinces, there might have to be quarantine in the local areas. So the Tourism Authority of Thailand information web that I mentioned yesterday has the English language recap of the provincial measures. Also, of course, the Provincial Committee on Disease Control has the authority for each province to consider province-specific measures. So please continue to follow all of this information. I'll move on to the general situation and the number of cases that we have for today. New confirmed cases that we have for today is also in a high number. We have 315 new cases for today, Sunday, the 3rd of January, 2021, making the cumulative number of cases in Thailand since last year 7,694. The number of recoveries, those who were discharged, stands at 4,337. The new recoveries to date is 38, making the cumulative number 4,337, as you see on screen. This is actually a high number. We regret that it is getting higher as the days go by. The other day was around in the 200s or 100. Now 315. So that, of course, is proof that we do have to be very rigid in our measures. The local transmission to date has been detected in 53 provinces, the same number as yesterday, fortunately. However, in Chanthaburi province, this became the latest province that has the number of infections within the province as higher than 50. Some information about the control measures. To recap the information that was mentioned yesterday, the CCSA is preparing to step up various control measures for COVID. You recall yesterday we talked about level 1 and level 2. To contain the spread of the pandemic, measures will include the prohibition of public gatherings, temporary closure of schools and establishments, and screening of people that travel across provinces. Now, this is for stepping up control measures in level 1. That being said, as you know, in some provinces, like in Bangkok, schools have been announced for those closures already. So those are province-specific measures. But nationwide, in terms of the upping of the level of measures, that is to be announced. The rationale of introducing such measures is to contain the new wave of COVID so that it will not spread to the rest of the country. We hope that all of us will comply with these measures, as this is crucial in controlling the new surge of local transmissions. Limiting movements across provinces will help assist greatly in this endeavor. I realize that some viewers have been viewing our broadcast intermittently, of course, not on a daily basis. So the advice is that you might go and see the playback of a couple of briefings, because obviously we provide information as soon as is possible, but sometimes we cannot repeat the same information every day. So if you look at the YouTube channel, for example, of the MFA YouTube channel, it's called MFA YouTube channel, you can see the various briefing summaries that we have on a daily basis. Some information may have to be recycled and repeated because of the importance of that information in terms of updating the audience as well. But for those who view this, for example, today's briefing for the first time, perhaps if you are uncertain about a certain information or have questions, you can always ask those questions on social media or go look back at the previous briefings. Another issue important is on the preparation of medical capacity, regarding the preparations of our medical capacity to deal with the new wave and any possible exponential increase in infections. The Public Health Ministry confirmed that it has adequate medical equipment in stock. These include surgical masks, gowns, and favipiravir medicine. The government has also allocated budget, and I mentioned this earlier, around 1.9 billion baht for the procurement of additional equipment like masks and medicines. And at the same time, the Department of Medical Services has prepared over 22,690 hospital beds to serve patients nationwide. Bangkok and its vicinity has 2,778 beds reserved for COVID patients already, specifically from Samut Sakhon and other provinces that have more than 50 cases, and you have some pictures there. To complement the efforts of the Public Health Ministry, the Royal Thai Navy has also assigned the Naval Medical Department to prepare 4 separate hospitals under its supervision, additional facilities for state quarantine in 3 field hospitals. 2 of them are in Chonburi province, and the third one is in Chantaburi province. These field hospitals, you can see some pictures on screen. These will be used only in the unfortunate case of a widespread outbreak of COVID-19 to the point that the capacity of designated hospitals cannot accommodate COVID-19 patients. The spokesperson also addressed certain questions, important questions in the Q&A session just now. First is about the use of the terminology, the word lockdown. The question was, why is the word lockdown not used as a full lockdown, an actual lockdown? Well, his answer was that an actual or full lockdown, of course, would have certain repercussions, certain effects. When you define a lockdown as an actual lockdown, the economic system, the income of people in certain sectors and businesses will be effectively affected. That's kind of quite worrisome. So the approach that we are taking is to use a viewpoint that is sort of a balance, a balance and a spread of joint responsibility, a balance of strong, stringent measures when we have to in certain areas, and of course not using the actual term lockdown because of the balance that we have to maintain the normal everyday lives, the running of the economy and the like. And we see this as a joint responsibility, of course not only as government or CCSA, but as mentioned time and time again before, in many briefings before, also by the spokesperson, by the government, by the Prime Minister, it's a joint responsibility of the whole of society in Thailand. And we do appreciate this. It's very important. We've come this far because of the joint responsibility. And another point is that, of course, if we announce a lockdown on restaurants and use the term lockdown, a general overarching term lockdown, it does not mean that one lockdown of one sector of society, of business, will actually prevent the spread of COVID in itself. Of course, the announcement of a prohibition of a banning of flights, domestic flights, for example, that in itself will not take away COVID from us. It's a joint responsibility. It's a joint dedication, a joint sacrifice of various sectors in society. So not only one business sector in that. Of course, we try to look at it in terms of as targeted measures that are better, that would better address specific areas, targeted measures that will sort of like address certain sectors more effectively than saying that it's a general lockdown. And as you know, we've been doing that in different sectors, gradually, in different locations, as needed. So that's very important to understand the balance of a rigid lockdown with the needs of the people to have to continue with their daily lives. But of course, we will be rigid in the areas that we have to be rigid. We will be strict in the areas that we can be strict, in the areas that are necessary to be strict. All of this, of course, because the high numbers are there. We have 300 per day. Please continue to follow the announcement by the CCSA. One case in point is, of course, restaurants, and of course by the announcement by each provincial authority and Bangkok Metropolitan Administration for residents of Bangkok as well. So during this critical and difficult time, of course, besides from complying with the control measures, it's equally significant that we remain socially responsible, we remain compassionate while being mindful that when everybody is safe, we will also be safe and protected. So thank you very much for your attention for today, and we'll see you again tomorrow. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพนุ นพ